So, third day after surgery for total knee. Wanted to talk about a couple things that I'm going through and hopefully help you out. Um, the main complications you've probably heard, you've been told over and over as you get ready for surgery and when you're in the hospital, trying to avoid blood clots. That's the biggest concern and complication, and obviously infection. But besides that, there's some things that we in physical therapy we run into down the road that we can prevent a lot of those complications just in these first probably 3 to 6 days. So I want to take you through some instructions that they've been telling you, but maybe you don't grasp the ramifications down the road. So there's one thing that here I'm going to show you my knee now while I'm talking. So there's something they're talking about where they're wanting your legs straight a lot. I want to talk about that just so that you understand the importance of that. The number one complication, besides the big ones that we already talked about in rehab, is not regaining full extension of your knee. And when I say full, and we're talking about all the way straight, just like your other knee. Even if you don't get like we call it -3 or -2 degrees, even that amount, so you're only 2 to 3 degrees off, has a significant effect on you down the road. And mainly it's because of walking. So in a normal gait cycle, you have there's a portion of your gait cycle where your knee is straight and your thigh muscles contract just momentarily, but that's a normal pattern for your walking and for your leg, and think about your knee too. So there's a point there where there's no stress on the thigh. So when that does not happen, imagine walking like a frog walk, or imagine walking in a squatted position all the time and the stresses that are happening on your knee, especially your kneecap. So people that don't regain full extension, often later after rehab, and sometimes it's 3 to 6 months later, will develop pretty significant kneecap pain and inflammation. Is basically like a tendonitis of the tendons around the knee or the kneecap due to overstress, because it's not designed to do that. So back to the point. It was interesting because in the hospital, everybody kind of they're all trying to get you to have your legs straight, and they have different explanations on how to do it and why. But and I just noticed that they never tell you the ramifications and how important it is to do that, and what might happen if you don't do that. So I want to back up just a little bit. The truth is, this is not comfortable. Gets very achy and very painful. So I think there's conflicting information coming from the nurses, the doctor, even the physical therapist sometimes on this propping up of your heel and your ankle. So for me, and this works well for my patients, the truth is you can't stay like this all the time. Because what happens when you get when you have pain in your knee and you're not paying attention, you're watching TV or trying to distract yourself, when there's pain there, your body is going to naturally find a position where it's not painful. So what happens, you're just going to contract your leg a little. I'm exaggerating a little bit, but you're going to contract that leg and take pressure off of it, even though you think you're propping your heel up. And then that's going to encourage that contraction when you're not paying attention. So, And plus, it's really stressful on the knee. You are going to get some additional swelling if you stay like that all the time. So I do recommend that you get comfortable and you get a little bend in your knee for the majority of the time when you're down propping that leg up. But I would definitely recommend like once an hour that you really get that big gap underneath the knee. I'm going to show you here. So there should be space underneath there so that you can relax and get full extension on that. You can push it down, but I do recommend once you get it pushed down and kind of there, I want you to relax as much as you possibly can. And then you really need to hold this quite a while. So I usually recommend 3 to 5 minutes, and it should get pretty achy, not extremely achy, but you should feel pressure and you'll build up some ache in there. When I first started doing that, I could only tolerate about a minute, which is fine. So then it's really kind of achy coming off of that. But if you bend it a little bit and then just pump that knee, kind of gets the juices flowing back in there so that it's kind of happy again. And then basically I go back down, push a little bit, and then relax, and then don't think about it too much. Try to relax, and gravity's going to take care of that. It's going to slowly take you down to where it wants to be. You don't want to push on this too much. It's still really swollen in there. So if you're starting to push and really trying to push on getting an extension, you can just create more swelling. So you're really just using the weight of your leg, letting gravity kind of slowly push some of that swelling out of the way and get that stretch back into the knee so that you can get your knee extension back. Again, simple. They seem simple, but the ramifications of not getting your knee straight again are really hard to address. Even 3 weeks into your rehab, 6 weeks into your rehab, if you don't have knee extension, then it gets really complicated and it delays everything and can create all kinds of problems down the road. So that's the heel props. Again, once every hour, and you want to spend about 5 minutes really just getting that knee straight, and then you can take some pressure off of it and get some support on there so you're comfortable and you're not in too much pain.